everyone, and thank you so much for joining today's NeedyMeds special topic webinar, Tips for Making the Most Out of Your Doctor's Appointment, presented by NeedyMeds Partners, the Lupus Foundation of America. So, as I said just a moment ago, my name is Carla. I'm the Director of User Engagement at NeedyMeds. And before we kick off today's presentation, which I'm very excited about, I want to go over a few points just to offer so that you can make the most out of the presentation. So first of all, if you do have questions, you can ask them at any time by typing them into that question section of your GoToWebinar control panel. Just know that we do reserve answering questions until the end. If we don't have the time to answer your question, we will follow up with you personally by email. But of course, we will also provide the contact information for both the Lupus Foundation of America and NeedyMeds. This webinar is being recorded and will be available on our YouTube channel. And as you saw on the first screensaver screen, you can find our PowerPoint slide decks as well as other materials we thought you'd be interested in that handout section of your GoToWebinar control panel. So let's dive in with what is NeedyMeds. For those of you not familiar with us, what you're looking at on our screen is our mission statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our helpline, 1-800-503-6897, and our website, needymeds.org. I always like to put up a screenshot of our website because really it's the face of our organization. And as you can see, and hopefully you'll agree, it is full of information. So I hope you get a chance to browse the site further when you have time. For now, I'm just going to point out a few resources. First of all, if you are looking for healthcare cost savings programs, you will want to begin your search, you probably guessed it, under that Healthcare Savings tab. Right next to that is the Education tab, where you'll find all educational information. And this is where you can sign up for other webinars, monthly newsletters, and order brochures, for example. When we just got started, I mentioned that today's webinar is being recorded, and you can find it on the NeedyMeds YouTube channel. And you can find a link to that on the top right hand of our homepage with the rest of the social media icons. It's the third one from the left. And I do encourage you to subscribe. That way you'll be notified when new content such as videos, webinars, or presentations are added. And I did mention that you can find webinars under that Education tab, but you can also see upcoming webinars, what they're all about, and register for them on the calendar of events on the bottom right hand of our homepage. So let's get started with today's presentation and the reason you're all here. And I am so happy to see such a robust turnout, and I know nobody's going to be disappointed because the tips that are going to be shared today are really applicable to everyone. So I'm excited to get started with that. First, I just want to say that as you may recall just a few slides ago, I had a screen with the NeedyMeds mission statement, and a big part of our mission is educating people. And of course, we do that by letting people know or educating people about NeedyMeds and the resources we offer, but also letting them know about other organizations and resources that can help them become better informed healthcare consumers, which is so important. And that's why we are so pleased to have our guest, Ashley Holden from the Lupus Foundation of America, here with us today. So before I tell you a little bit about Ashley, let me just tell you a tiny bit about the Lupus Foundation of America. They have made pioneering contributions toward ending the brutal impact of lupus, a misunderstood and unpredictable disease. The Lupus Foundation of America's mission is to improve the quality of life for all people affected by lupus through programs of research, education, support, and advocacy. Their efforts stimulated advances in lupus research that are providing insight into the underlying causes of lupus and its progression, while creating unprecedented opportunities to expand the future knowledge base for lupus. So now let me tell you a little bit about our guest and my friend Ashley Holden. Ashley is a health education specialist at the Lupus Foundation of America's national office. She is a nationally certified health education specialist from the National Commission for Health Education Credentialing. She also has a Bachelor of Science degree in public and community health, a Master's of Education in health education, and also brings with her over a decade of experience working in community health and the health insurance industry combined. And with today's presentation, Ashley is going to provide tips to make the most out of your next medical appointment. And this is really important because the more prepared you are, the more likely you will be to discuss the issues that are most important to you and leave with a plan in place. And based on that introduction to Ashley, you can see why I'm so excited that she's going to be the expert that walks us through this really important topic. So without further ado, and hopefully seamlessly, which is always my goal, I'm going to go ahead and pass the mic and the screen to Ashley. And as she grabs that and puts up her PowerPoint presentation, which of course, because she's a consummate professional, she did that in lightning speed, I will take a moment to remind everybody that if you do have questions, don't hesitate to go ahead and submit them by typing them into that questions section of your GoToWebinar control panel, and we will do our best to get to them at the end of the presentation. So now I'll go ahead and pass the mic to Ashley. Enjoy the presentation, everyone.
Thank you so much, Carla. It is a pleasure to be here today, and I'm excited to be talking with everyone today. And first, I would like to just go over the Lupus Foundation of America's, or LFA's, resources and ways to get involved with us. I know that not everyone attending today might not have lupus, but I do know that you may know people that have lupus, and you may never know when these resources may come in handy. So just tuck them in your back pocket and keep them in mind for future interactions with people if you don't have lupus. So Carla did a great job talking about our vision and our mission statement at the Lupus Foundation of America, but really it's so important that I just want to touch on it again. We really envision a life without lupus. That's our vision. And so we're dedicated to improving the quality of life for all people affected with lupus through research, education, and advocacy. So we have lupus awareness here. So we know that low awareness results in late diagnosis, increased morbidity, and increased cost. So there's just some different statistics here relating back to lupus. So if you're not familiar with lupus, we do know that there's about 63% of Americans between the ages of 18 to 34 that know little or nothing about lupus. So that's a pretty big number. So those that have lupus, it can take on average 6 years to receive a lupus diagnosis. They may have to see at least 4 doctors before they get that lupus diagnosis, sometimes having to see more than 4 doctors. And then those that do have lupus, a good majority of them list chronic pain as the most difficult aspect of lupus. And then a lot of people with lupus have multiple autoimmune diseases. So you can see that they are 1 in 3. First, I want to talk about our National Resource Center on Lupus. So that's a one-stop resource for all things lupus, from treatment to living and coping with the disease. It aims to ensure that anyone affected by lupus, including people diagnosed with lupus, caregivers, and healthcare professionals, have access to high-quality resources that provide emotional support and clear, accurate health information. We also have health education specialists, which I am one of the members of that team. And so we're trained to provide people with lupus, their families and caregivers, with non-medical counseling, disease education, and helpful resources. Our health educators can help you find trustworthy information and answer your questions about lupus and how to cope with it. You can see how to contact a health educator here. So you can visit our website, lupus.org/health-educator. You can submit your question online, and we'll respond via email. If you prefer, we also have a phone number that you can reach out to us as well. If you didn't catch this on this slide, it is in the PDF of the slides, and I know Carla will also put up this contact information in a little bit later today. We also have what's called Lupus Research Accelerated by You, or RAY, and that was developed because people with lupus are so important to the research process, and that's why we really developed this online platform. So even if you don't have lupus, you may want to consider being a part of some type of registry or clinical research if you do have some other types of diseases, so that we can continue to make progress in research for these diseases. You know, I know that we've made a lot of progress, but we definitely have a ways to go for a lot of different diseases. So as far as lupus goes, we know that researchers need help. So you can help advance lupus research right from the comfort of your home by participating in RAY. Again, if you have lupus or you're a caregiver for someone with lupus that's a minor. You can share experiences with lupus to help you inform future clinical trials of new lupus treatments and identify the most pressing needs for people with lupus. And then quickly, I just want to talk about some of our other programs. We have a lot of different ones, but one that may be of interest is our Expert Series. That's a monthly educational podcast where our team interviews experts in the field about topics that are important to people that have lupus. We also have support groups. So we have more than 150 support groups across the country where people with lupus can come together, ask questions, and listen to others. We also have Lupus Connect, which is our online community where people can engage with each other and ask questions. We also have a lot of different ways that you can get involved. So whether you have lupus or you have a loved one with lupus, you might want to get involved and support the fight to end lupus. So one way is our Walk to End Lupus Now, and we know that a lot of people usually have participated in many of these walks across the country. Due to everything that's been going on, our walk this year, just like last year, will be virtual. And our virtual walk this year will be just a few days from now, if you're listening to this live. And our walk will be on October 16th, 2021. We also have Make Your Mark, which is our community fundraising program. And that's a way to turn an event into a fundraiser for lupus. So you can use your passion to raise funds for lupus through an in-person or most likely a virtual event. And finally, one of the most powerful tools we have is having our advocates use their voice. So we are the leader in stimulating federal support for lupus, generating more than $615 million for lupus research and education in the past 5 years. Every day, we fight to ensure the government is responsive to the needs of the 1.5 million Americans living with lupus. So I mentioned this already, but we do have local support groups, but we also have some local offices and regional and chapters. So they offer local programming, support, and events as well. So if you are interested in learning about our local chapters and regional offices, you can visit lupus.org/chapters. So I know that this is the main event for what everyone probably joined for today, especially those if you don't have lupus. But we're going to talk about how you can prepare for a medical appointment. And we're going to focus on 5 main areas when it comes to preparing for that appointment. So first, let's talk about managing expectations. You know, perhaps you were recently diagnosed by your primary care provider and they referred you to a specialist. You know it's important to see the specialist in a timely manner. But when you call, you're shocked to learn that you must wait weeks before you can get in. You know, what can you do in the meantime? So first, let's talk about scheduling appointments. Your first opportunity for a good visit to the doctor comes when you schedule your appointment. You want to be understanding when scheduling that appointment. Like I mentioned, it may take a few weeks to get an appointment. The staff understands that it's important for you to see the doctor and will help to get you scheduled as soon as possible. We have to take into consideration that sometimes some of these doctors, especially specialists, are backlogged because of not being able to see patients in person due to the pandemic. So they're working as quickly as possible to get people in. Sometimes it's just not feasible for you to be able to see that doctor, and the next week you might have to wait a little bit. So to put appointment wait times or of weeks or even months in perspective, there's a projected shortage of 2,500 rheumatologists by 2025. And so 2025 is not that far off. So we know that there's doctor shortages, which makes it hard for patients to get in and see these doctors. Another thing when it comes to scheduling appointments, you want to take the time to talk to the staff about the visit you're scheduling so that they can make sure they schedule enough time and can take care of your concerns during the visit. So if you have urgent concerns, you should let the staff know. They may be able to work with you in the schedule, but you should be prepared to wait a little longer in the waiting room if they squeeze you in. And then you also want to keep in mind that you may need multiple appointments if you have a long list of concerns or if your doctor is working to give you a diagnosis. And then when you can, try to make your appointments at least a couple of weeks in advance or even longer if it's your first visit with a new doctor. This will give you time to prepare for the appointment and allow for time for your medical records to be transferred from other care providers. Obviously, I know advanced scheduling is not always possible, but sometimes it's especially helpful when you're seeing a specialist for them to have your medical records and be able to see that big picture. Again, there are circumstances where you would need an urgent appointment and may not be able to wait. So as I mentioned, it's important to keep in mind that you may need multiple appointments if you have a long list of concerns or if your doctor's working to give you a diagnosis. So when you're scheduling those appointments, you might want to find a good way to be organized and keep them on a calendar or use a calendar on your phone to remember your appointments. You can also put all of your doctors in your cell phone's contact list if you have a cell phone. And then you can include their name, specialty, and address. So you'll be able to access their information no matter where you are. So I know a lot of times when we see a new doctor, you have to fill out a lot of paperwork. So maybe you need to access that information while you're filling out that paperwork. Or perhaps you're not home and you need to make an appointment with that doctor. So you can you have their name right in your phone and you can give them a call to schedule an appointment as soon as possible if they're able to fit you in that schedule. You can also work with your doctor's office or health insurance provider to see if they have social workers or care coordinators available. These individuals, if you do have access to them, can help to arrange and organize specialist appointments and help you prepare for your follow-up appointments or future consultations. So the next thing that we're going to talk about is the different ways that you can get organized. So I mentioned, if you can, different ways that you'd want to organize your medical history briefly. So the greatest part of your doctor's understanding of what's happening in your body will be based on your description of your symptoms, both now and in the past. While your doctor also needs to examine you and look at results of your laboratory or imaging tests, your personal history gives valuable information. So the more organized your medical history is, the easier it will be for your doctor to begin to consider possible reasons for your health complications. You can keep a binder or folder with copies of your medical records. The binder will keep you organized and keep all of your important papers in one place so that you won't have to hunt down information before your upcoming appointment. You can keep copies of your visit summaries, list of your current doctors, and current medications in this binder too. I know a lot of times, depending where you might see a doctor, there's online portals now with copies of your laboratory results. So if your doctors are within the same health system, they may have access to that. But it's never a bad idea to have copies of it for your own records as well. And again, it's a good place to keep a current list of your doctors if you don't put them in your phone, or your medications as well. I know sometimes that way you don't have to lug your medication bottles to a new doctor while you're filling out that paperwork. You'll also want to track your symptoms. So you can keep a journal of your symptoms, include a timeline and descriptions of your symptoms, including those that have disappeared. We do have a checklist available in the National Resource Center on Lupus to help you keep track. And that is also available on one of the attachments for today. We do have those attachments. So we have those. And then, as I mentioned, your doctor really needs to know what medications you're taking, including those prescribed by other doctors. And if you're taking any dietary supplements, so that could be vitamins, minerals, herbs, anything that's over the counter. As I mentioned, some people decide to bring all of their medications and dietary supplements, both prescription and non-prescription, in their original containers to the doctor. Sometimes that's easier because you have all of the dosage. You could also, as I mentioned, have a list of that you print out and keep that in your binder or your folder, whichever works best for you. You'll also want to mention any medications that you're not taking. So if for some reason you stop taking a medication, that's important to mention too. And you'll want to share the reason. Was it the side effects of that medication, the cost, or some other reason? Did you get online and read some research about that medication? So you want to make sure that you share that with the doctor too, because that could determine what they do prescribe for you, or they can discuss some of the concerns that you have. You'll also want to anticipate what the doctor will ask. So they may ask a lot of different things. Let me see. There we go. I knew I had those questions somewhere. So these questions can apply to most symptoms. So think about how you would answer them. So think about, when did the symptoms start? Is this a new symptom, or has it happened before? Does anything trigger it? Do you have it every day, or does it come and go? What time of day is it the worst? Does it interfere with your daily routine? And if that symptom's causing pain, how severe is that pain? So again, think about these questions and have answers prepared for them. Obviously, I think we all know these things if we're experiencing something, but sometimes we get in that room and we get rushed and it just doesn't come to the tip of our tongue quickly. But by being prepared, we'll have those answers to help give that doctor a good picture of what's going on. And then just one other thing about preparing for your doctor's appointment. Don't forget to make a list of topics and questions you want to discuss with your physician. And then you'll also want to prioritize the topics and questions that you feel are the most important for your doctor to hear about. So this way, if you don't get through the whole list, you still have the most important questions and concerns addressed. So it's also important to be proactive prior to your appointment. It's important to understand your disease or your condition. So it's important to have that understanding before you go to the doctor. Obviously, we don't want to use the internet as a replacement for our doctor, but if you have information about the disease, you'll be better prepared for the appointment. So learning as much as you can before the appointment can help you recognize different terms that the doctor may use. It may give you an understanding of different tests that the doctor may mention. it can also ease your anxiety about the diagnosis process as well. So different types of doctors or specialists include rheumatologists, dermatologists, cardiologists, nephrologists, gastroenterologists, and pulmonologists, just to name a few. So when you get that understanding of your disease or condition, you'll also hopefully learn what type of doctor treats that disease. In the case of lupus, all of those different specialists that I mentioned may see somebody with lupus. So it is possible that you may need to see multiple specialists for one disease. So I know I mentioned a little bit about how not many people know what lupus is. And so I'm going to go ahead and use lupus as an example of how we can be informed about a disease. So, lupus is a chronic autoimmune disease that can damage any part of the body, such as the skin, joints, or organs. So by learning more about this disease, we learn that it's not related to cancer, it's not contagious, and then we learn that it's different from each person. So that research might help us to learn some of the things that we're looking for as far as lupus goes. You might also, while you're doing that research, learn who does get lupus. So you'll learn that lupus can develop in anyone, male or female of any age, including children, teenagers, and adults. Lupus strikes mostly women of childbearing age, but men and children and teenagers can develop lupus too. So lupus is 2 to 3 times more prevalent among women of color, African Americans, Hispanics or Latinos, Asians, Native Americans, Alaska Natives, Native Hawaiian, and other Pacific Islanders than among women. So this is, while you're doing that research, you may find that this is more prevalent for someone like yourself. And so we also, a study found that minority women tend to develop lupus at a younger age and experience more serious complications and have higher mortality rates. So again, you can use this information. You certainly want to keep an open mind when you go to your doctor, but maybe you've been looking up symptoms and you're starting to get an idea of what's going on. So something that you can see the different symptoms of lupus here, but maybe you didn't really think much of your headaches. Because you've been working from home and staring at your computer screen, or maybe you thought your body was sore because you've been going to the gym. But when you start doing that research, you start seeing that you have a lot of these symptoms, and maybe they're related to each other as opposed to just being these one-off things that are occurring. So this also shows why a symptom tracker could be helpful. Because you can track these different things, and you may be able to see if there's any kind of trends going on. So for instance, in lupus, people can be sensitive to UV rays or the sun, and that can trigger a flare of symptoms. So that might be something that if you're tracking that, you might see a trend. You might have a rash appear after you've been outside, or maybe you were on vacation. So as I mentioned, you may want to be familiar with how your disease is diagnosed. So in lupus, there's no single diagnostic test for lupus. The doctor will use a variety of tests to help them see the big picture of what's going on. The doctor will also take a look at your medical history and any symptoms you've had in the past. And depending on the type of lupus that they suspect, or any kind of organ involvement, they may also do biopsies of the skin or the kidney. So I know I've talked a lot about lupus, but I just want to give you a little bit more. And so lupus is a disease that is known for being difficult to diagnose because the symptoms are different from person to person. They can come and go, and they mimic the symptoms of many other diseases, such as rheumatoid arthritis, blood disorders, fibromyalgia, diabetes, thyroid problems, Lyme's disease, and a number of other heart, lung, muscle, and bone diseases. So it can sometimes take several years for a person to receive an official diagnosis. So again, I mentioned on average 6 years. The diagnosis process can be complex, And being familiar with the disease, even if it's not lupus, can help ease your anxieties in the process. So by understanding that information, you might understand that this is a process and it's not something that, depending on the disease, it's not something that you might get a straightforward answer from just from one test. You may also want to research about possible treatments so that you can have questions prepared ahead of time about that medication. So it kind of just depends where you're at in the process, but it never hurts to have that research and being proactive in learning about the disease or suspected disease ahead of time. So communication is key. I think communication is key in life, not just preparing for your medical appointments, but it can certainly help to make your appointments a bit smoother. So again, you'll want to remember to bring your medical history, prescription history, symptom tracker, and list of questions that you worked so hard to prepare for your appointment. I don't know about you, but I know that I am notorious for preparing these things, having them all ready to go, and then forgetting them. So I know we may laugh about this, but really it is important to remember all of that, all those documents you put together and did all that hard work to prepare. So all of that information will give your doctor a clearer picture of what's happening with you. So to ensure the best management of your disease, it's essential to create a partnership with your healthcare team that includes clear communication. Be sure to tell your physician about any changes in your symptoms. This can help during your evaluation and when ordering tests to ensure that your doctor has the best understanding of your current health. Be sure to tell your doctor everything that you're doing that could affect your health. Remember, your appointment is confidential. So are you taking any over-the-counter medications for a different condition? Or are you on a diet? Do you have any stress at home? Have you made any significant lifestyle changes? All of these things could impact your health, even if it's just emotional stress. Sometimes there are things going on in our lives that we don't think about as contributing to our health status, but they are things that probably add to what's going on health-wise. So when you talk to the doctor, be as specific as you can about each symptom. Think about when it occurred and how it affected you. Again, you can use that symptom tracker to keep track of that, and it'll help keep a good log of what you have going on. Also, don't be embarrassed. Your doctor has heard it all and probably then some. So if you're planning on discussing a personal topic, one way to avoid nerves is to practice what you plan to say in advance. It's also a good idea to bring paper and pen so you can take notes during the appointment. You may also ask the doctor, nurse, or pharmacist to write down instructions for you or to provide you with printed information about your disease or condition. Also printed information about medications or treatments. So this allows you to review that information after the visit in the calm of your own home. You can also share these notes with friends, family, and caregivers to help them understand how they can best support you in managing and treating the disease. I know sometimes we get in that doctor's office and we're like, I will remember this. And then we get home and we remember the big idea, but we don't necessarily remember all of the fine details. The small details might be a little fuzzy. So it's always helpful to have those notes or ask for that printed information, whatever works best for you. Some doctors may also be able to put that information out on a patient portal, depending what kind of systems they use. But be sure to ask for that information so that you have it for your own knowledge. Some doctors' appointments may make you feel emotional, stressed, or even rushed. And it can be helpful to have a supportive family member, friend, or caregiver accompany you to these appointments. They may also be able to help by taking notes or helping you recall what was said during the visit. And also, I want to remind everyone to keep an open mind. So if you go to a doctor's appointment with a fixed idea about what is wrong, you and your doctor may overlook a key aspect of what could be causing the problem. So I know that I mentioned being proactive and reading the research, and I definitely think that that's great. But don't go down just one avenue if you're not quite sure what's going on. Explore different options, and make sure that your doctor is also keeping an open mind, depending on what you may have going on in symptoms, to try to figure out what may be causing that. So the end of your appointment is just as important as the beginning. So don't hesitate to let your doctor know about any questions or concerns you may have. It's best to be proactive in voicing questions and concerns, as opposed to depending on your doctor to ask the right questions. So if you have any doubts about something your doctor has said, don't hesitate to continue asking questions until you feel satisfied with the answer. I know sometimes we might feel like that doctor's annoyed with us, but make sure you have that information that you really need to give you a peace of mind, or at least give you an idea of what your next step should be. So before leaving, you might want to ask your doctor some of the sample questions that are listed here on the slide. And I won't go through all of them, but think about the questions that you may have prepared ahead of time. Ask those questions for clarification. And then, depending on where you're at in the diagnosis process, or if you've already been diagnosed, you might want to ask them if there are any medical conditions that they could rule out. Ask them if there's anything you can do at this time to feel better, especially if you're not diagnosed, but you're not feeling great. Ask them what you can do in the meantime until you do have a formal diagnosis. And then also, you can ask if there's anything you should not do at this time. So there's a long list here, but be sure to ask questions to give yourself some clarification of what's going on. You can also ask for a visit summary or a follow-up summary instructions at the end of the appointment. Your doctor should go over what was discussed, any decisions made about treatment, if any, and any suggested changes to your medication. However, doctors who are hurrying to stay on a schedule or already behind on their schedule may accidentally forget to do this, or may not fully explain what you need to know. So you can remind your doctor to give you a brief verbal summary of what has been discussed, such as your diagnosis possibilities, diagnoses that are ruled out, symptoms to look for, activities to do or not do, let you know of any kind of follow-up that you need to do, including any forms for new lab tests, and tell you what you should have, when you should have your next appointment. So those are all good things to kind of wrap up your appointment with. So also, you want to make sure that you do make your follow-up appointment if your doctor does recommend it. So I know sometimes you'll say, oh, come back in 6 months to a year. So I know I can personally say I'm notorious for forgetting to make that appointment. So, if your doctor's office has their schedule available early enough, make that follow-up appointment before you leave. If they say, hey, we don't have the calendar, the schedule available to make an appointment in 6 months or a year, put a reminder in your phone. So put that reminder in your phone in a few weeks or a few months that says call and make an appointment, so that you're not forgetting to schedule that upcoming appointment. The earlier we can schedule that appointment, the better that we know we'll be seen in the proper time frame, and that you can hopefully get your top choice of an appointment date or time. Sometimes we're not that lucky, but hopefully it'll make sure that we're seen on a regular basis, especially since we know that some of these appointments are hard to come by. Also, I want to talk a little bit about self-advocacy. And so I think it is important to be a self-advocate. And by advocating for yourself, you enable your doctors to treat you effectively. In order to give you the best care, your doctors need as much information as possible about what you are feeling and noticing in your body. So empower your family members, friends, employer, and healthcare providers to give you the support that you need. Most people want to help, but they can only do so if you're clear about what you need. So ensure that your needs are being addressed. No one knows your body, your emotions, and your mental stresses as well as you do. And that's why the best person to advocate for you is you. So if you don't feel heard by your doctor, take a deep breath and politely and firmly insist that your symptoms are real and that you would like further evaluation. There's also a resource here. It is the expert series, as I mentioned, our podcast series that talks about becoming a self-advocate. We also have some additional resources here that talk about lessons that were learned to help improve your care experiences, getting the most from your medical appointments. So again, some different resources to help you as you prepare for a medical appointment and being an advocate for yourself. So a lot goes into preparing for your doctor's appointment, and it's not only important to prepare for your doctor's appointment, but be an active participant during and after your appointment so that you get the care that you need. Every doctor's appointment is your opportunity to explain and discuss your problems and concerns with someone whose job it is to listen and help. The better prepared you are for the appointment, the better you will feel about the experience, and the closer you'll be to receiving an accurate and timely diagnosis. Or if you've already been diagnosed, it'll give you a better opportunity to work with your doctor to better manage that condition or disease. So here's just a quick slide with our contact information, including where we can be found on different social media channels. Again, don't hesitate to reach out if you have lupus, think you have lupus, or just would like more information about us as an organization. And with that, I want to thank everybody for tuning in, and I'll go ahead and ask Carla if we have any questions.
Fantastic. Ashley, thank you so much for that very thorough presentation. And I can see by the feedback we're getting, really this was a hot topic. A lot of people are interested. And certainly what I love about this presentation is it's applicable to everyone and can be shared with everyone. And as Ashley said, we're going to go ahead and take some time to get to the questions coming in. And I do see quite a few. Before we do that, a couple of things I want to bring to everybody's attention. As Ashley said, go ahead and ask questions. I want to remind you can do that by typing them into that question section of your GoToWebinar control panel. And again, if we don't get the chance to answer your specific question, we will follow up with you by email. But of course, I'll put the contact information for both of our organizations up at the end of the presentation. In the meantime, I want to remind everybody that NeedyMeds is here as a source of support if you are having trouble affording any of your healthcare expenses. If you are, give us a call at that 800 number, weekdays 9 a.m. to 5 p.m. Eastern Time, or check out that Health Savings tab on NeedyMeds.org. You can always join us for one of our monthly overview webinars, Help with Affording Healthcare Expenses, that will walk you through all of the ways we can help you to save on your healthcare expenses. As promised, there's a contact information for lupus on the screen and NeedyMeds contact information at the bottom. So let's get to some of the questions coming in. One is, and this one, I bet you've been asked this before, and this is absolutely something that I can certainly ask myself, which is, my provider is always in a rush during my appointment. Unfortunately, I think that's something that a lot of us can relate to. How can I get him or her to actually listen to my concerns?
That is a great question. And yes, I think we can probably all relate to that. So I would say, again, it's really important to clearly communicate what you need when you're scheduling the appointment. So different types of visits have an assigned amount of time for the provider per patient. So by communicating your needs, they can schedule you for a longer appointment time. Hopefully something's available. You could also ask if the doctor does any type of consultations in their office outside of the exam room, if you have a long list of topics to discuss. Every office is a little different. Generally speaking, annual appointments are typically longer than regular checkups, especially if somebody has like an autoimmune disease. If they are flaring, a lot of times they'll have a longer appointment time scheduled versus someone that is in remission and they're just kind of doing a 6-month or an annual check-in. So again, problem visits may be slotted for, depending on the type of doctor, some visits are slotted for the shortest amount of time, depending on what's going on. I think the other consideration here too is your doctor always in a rush and not willing to listen to your concerns? And that's something that you would have to evaluate yourself and decide if seeing that doctor is worth it, or should you seek another doctor of the same specialty to be your main provider for that condition. Sometimes the doctor could be great, might be you might have had a good experience with them years ago, but maybe they're not the best fit for you anymore. Depending on what's going on, you're just not getting what you need out of those appointments. So again, that's something to think about as well.
So important and invaluable information. One thing I am going to take a moment to share. Can you see, Ashley, are you looking at the NeedyMeds website right now?
Yes, I can see it.
Great, because when there's a question coming in about getting second opinions, and which I think certainly is germane to what you talked about, so we'll get to that in a moment. And one of the other questions is about getting previous medical records. And that prompted me to think of a relatively new resource that NeedyMeds has, a new partnership we have with MyLinks. And as you saw, I clicked on, this is the NeedyMeds homepage, needymeds.org. And on the right-hand side, you will see this link for MyLinks. And as it says, this is where MyLinks is a free app for your phone. And this is where you can gather, manage, and share for free all of your health records from one secure location. So I thought that was really germane to what we were talking about, so I wanted to point that out. So let's get back to that question of when do I get a second opinion, and sort of a twofold question, how do I get my medical records?
Okay, great. Yeah, so that's a great resource. I think that as we move forward, technology certainly makes it much easier for us to have access to our records, especially with electronic medical records these days. So we can have access. It's great to have apps and tools like that. Now, I would say, in the past, before we had access to all this great technology when it works, right? A lot of times stuff was a lot more paper-based, right? So I would say, if you have previous doctors from years ago, how do you remember who you saw? So, keeping copies of any copies that you may have in a safe space. So if it's a portal that you always have access to, great. Again, if you want to have a binder or a folder with copies of your lab results. If you are trying to find old information about an old doctor so that you can get copies of your records, see if you have any old explanation of benefits from your health insurance company. You might be able to find the provider's name there. So those are all good ways to hopefully be able to find your past medical information, especially if you can't remember those doctors. If you've seen a lot of specialists trying to get a diagnosis, you might not remember their names. So you might be able to go through old insurance records to get that. Again, and like I said, it's important to keep those copies, and that tool that Carla showed is a great way to be able to keep everything in one place. And all of that information would be extremely helpful if you decide that you would like to get a second opinion. Sorry, it took me a minute to get there. But when we think about a second opinion, only you can decide if you should get a second opinion. There are some common reasons that people would decide to get a second opinion. So if you're having trouble talking to your doctor, if you don't feel comfortable discussing sensitive topics, that doctor may not be a good fit for you. You should have a doctor that is willing to listen to your concerns, and that you feel comfortable sharing those concerns with. If you get in there and you don't feel comfortable talking about a sensitive topic, you might want to consider getting a second opinion. Maybe it's something that's sensitive and you would prefer to have a doctor of the same sex, or something to that extent. You might want to consider getting a second opinion. You might want to also consider getting a second opinion if your doctor is not a specialist for your condition. So sorry to link it back to lupus, but a good example of this is, a lot of times the general practitioner or family practitioner may suspect that someone has lupus, and they could diagnose that person with lupus, but they're not a specialist for lupus. So you might want to get a second opinion from, let's say, a rheumatologist in this case, to confirm that diagnosis. Also, you could get a second opinion if you want to explore if there are other treatment options that your doctor hasn't provided. And then also, a lot of times people will get a second opinion if the treatment recommended is risky, like if it involves surgery or could have lifelong consequences. So it just kind of depends what's going on, but there are a lot of good reasons to get a second opinion.
Thank you so much, Ashley, and a really good question. And although you said, you were bringing it back to lupus, the reality of it is that question and your answer is really, again, applicable to everyone, which is why I'm always so excited when you're willing to come and host this webinar for the NeedyMeds audience. I do actually have an attendee that asked a question a while ago, and it is lupus related, and it was interesting. And I don't know if you're actually going to be able to answer this, Ashley, because it might be one of these things where, you have to simply say you'd have to refer back to your doctor or further investigate. But I'm wondering if you ever heard this, that what if you have all of the symptoms listed for lupus, but the lab tells you you're negative? Is there some healthcare professional that will still treat you for lupus? Again, I don't know if that's something that can be answered in a general way. It may be too specific, but I figured I'd put it out there.
So that's a really good question. And as I mentioned, people
Oh, Ashley, we lost you. You may be on mute. So we got up
sorry
to,
about that.
That's okay. That's okay.
Bit of internet issue.
No problem.
Question. So there are a lot of times where doctors will have an idea of what's causing your symptoms. So they might think that you have lupus based on those symptoms. They could think you have another disease that has similar, has similar symptoms, but they're not comfortable making a formal diagnosis because you don't have the lab work to support it. So it's going to be based on the doctor that you see. So sometimes you might want to get that second, third, fourth opinion. They may also, depending on the doctor, be willing to give you some type of treatment even without that formal diagnosis. So it's difficult, the criteria for lupus is always kind of changing with some of the lab work, and depending what the doctor goes by. But yes, so you might have all those symptoms. I would encourage you to continue keeping track of all of those symptoms, working with your doctor or getting another opinion, and then seeing if you can find a doctor that will still work with you even without a formal lupus diagnosis, because they do know that something's going on. It's just not there yet. And one thing to keep in mind as well is that lupus, the lab work can come and go. So your lab work might change over time. That could support a lupus diagnosis later on. So all of those things are really good reasons to keep working with a doctor or finding a doctor that you feel comfortable with, that'll work with you until that formal diagnosis is made. Does that answer the question? I hope. Sorry, it was a little long.
Yes. No, that absolutely does answer the question. And I'm now that I heard the answer to it, I'm really glad that we had an opportunity to get to it. So thank you so much to our audience members for participating. And thank you again, a huge thank you to Ashley for sharing her expertise with the NeedyMeds audience. I will remind everybody that we do convert all of our webinars, videos, and presentations into videos and upload them to our YouTube channel. I'm reiterating that because Ashley has presented for the NeedyMeds audience before, and she has given a presentation, for example, titled Lupus 101. So go ahead and check out our NeedyMeds YouTube channel to find those previous webinars. And I already, happy to share, have begged, pleaded, and sort of forced Ashley to also return in the future for NeedyMeds webinars as well. So check out, always remember to check out our calendar of events to see when she'll be presenting again, and also to check out and register for other webinars that you may be interested in moving forward. We do our best to keep the question segment of the presentation relatively brief, so we're going to go ahead and wrap up today's webinar. But if you did ask a question that we didn't get the chance to answer, we will follow up with you by email, but we absolutely encourage you also to visit lupus.org, needymeds.org, or reach out to the NeedyMeds call center phone number. And as you can see on there, there's also an email address for the Lupus Foundation of America that may prove helpful to you as well. So thanks everybody for joining us. Ashley, a big thanks to you, of course. Have a wonderful rest of the day, everyone. Take good care.